It saves heaps and heaps of money for you to pay insurance, to pay workers' insurance, and save doctors heaps of money for buying insurance. And those money come from you. Now, there's one great thing about ACC, because it pays all the accidents. Then very quickly you realize it's better to prevent it than paying it. It's cheaper. But it's a government body, so it needs evidence. They did a lot of study, and they found that study has shown Tai Chi helps to prevent falls. And so it pays for Tai Chi class throughout the country. Is that amazing? And it conducts its own study. So the study was published internally in 2009. They studied more than 1,000 people. They confirmed, like other studies, that Tai Chi helps to prevent fall, improve balance, improve physical strength, and physical function. This is a picture from ACC. They invite me to train most of the Tai Chi they taught throughout New Zealand. So they took a picture for me, and I thought I'd use that picture too. This is the world's biggest study for fall prevention. And don't worry about the little prints. The main thing is the result. It's conducted by New South Wales Health Department for 700 people. After 16 weeks of Tai Chi, and 80% of them did Tai Chi for arthritis, it's found that Tai Chi reduced the rate of the recurrent falls, which are the major problem, by 70%. Just to put it in perspective, in New South Wales, the health cost of falls resulting from older people who fall is $600 million. Translated in USA, it's about $20 billion per year. Minus 70% of that, 70% of $20 billion. How many classes can you run? How many Tai Chi classes can you run? But Tai Chi is more than fall prevention. It also does other things. Study has shown it's really good for arthritis. After 3 months only of Tai Chi for arthritis, people show 30% improvement in their pain, so they feel 30% less pain. They can do more. They improve their physical function. So they can walk up more stairs, they can be more independent, and they also improve their balance by 30%. They explain the fall prevention. Another study, Tai Chi for arthritis, this is a much bigger study published by the Arthritis Care and Research. This study, it basically confirmed the other study. It relieved pain, improved physical function. Tai Chi for stroke patients, published this year. After 12 weeks of Tai Chi, they improved their balance. Back to fall prevention. This is a very important study. For those who's not familiar with medical stuff, well, you don't really need to know. But it's nice to know a review is very important in the medical world. A review means somebody taught a lot of study, and then they look at it critically, and they find ways to compare and come up with a conclusion. This study published by the Cochrane Review, they study 111 studies. So just to read through it would take you a long time. That involved in 55,000 people. Just to get 55,000 people to study, it's a huge task. So in this study, it looked at different things that's supposed to prevent falls. And it came up with a conclusion. Exercising in a supervised group, participating in Tai Chi, and carry out individually prescribed exercise program at home are effective. Basically, it's saying that Tai Chi and individually prescribed exercise by physical therapies are effective. Tai Chi is very clear and it's effective, and it's a lot less expensive. But what's more important, doing something at home can get boring. Doing something in the group like Tai Chi, like what we do, it's a lot more interesting and people are more likely to stick to it. And that's been bear out, proven by studies. This is the last one, and it's very interesting because it went for 2 years and it's still going in its 5th year. And what is interesting is it's got to do with aging. You know, we're all looking for anti-age drug. Aging is, you know, your age is just a number. It actually is not important how young or how old that number is. It's the quality of life that makes a difference. If you can enjoy the beautiful day like today, if you can do things you want to do, your age don't matter. So quality of life is really what matters. In this 2-year study, which is a longer study, it has shown that the quality of life, how much you can do, how much you socialize, how good you feel about yourself. That's most important, how good you feel about yourself. Those are quality of life. 6 out of 8 quality of life improve. As we know, people get older, the quality of life is the thing that deteriorates. Now, I haven't read a more effective anti-age intervention than this one. Let me take the Tai Chi for Health program our team has composed, for example. This program are very, very carefully composed with medical experts who really know Tai Chi very well. Not just Tai Chi, but we know different styles of Tai Chi to a very deep level. And then we're able to make the program simple, very easy to learn. These programs are tested and shown by scientific studies to be safe, to be effective. And we have a standardized program, so you know anywhere in the world you learn and teach the same program with a very well-developed teaching method. Our teaching method is designed based on experience and medical knowledge. We train our instructor to teach it in the same user-friendly way, and also we train our instructor to teach it so it's safe for almost any participants. Our program would suit most people. The program that has been used in the USA, in Australia, New Zealand, Korea, Singapore, Hong Kong, China, I can't remember how many countries, but it's reached a lot of praise. And organizations like Arthritis Foundation of Australia, Arthritis Foundation in the USA, New Zealand, Singapore, most arthritis foundations in the Western world in different degrees support this program. And health departments in Australia and of course the New Zealand government, we conservatively estimate over 1 million people has learned and enjoyed the program. And that's experience to show people do enjoy the program and did help them. But of course, it's much better to have published studies. So to bring Tai Chi for Health program to the community, we need to make sure the trainings are proven and sound. We need to ensure that there's continuous study to assess how efficient it is, how safe it is, and it's really good to have organizational supports.